Welcome to this explainer. If you're tuning in today, there's a really good chance that you, or maybe someone you love, knows exactly what it's like to live with the frustrating daily grind of chronic knee pain. You know, the kind of pain that literally makes you sound like a bowl of Rice Krispies every single time you stand up. And look, when conservative treatments just aren't cutting it anymore, and the mere thought of major surgery feels totally overwhelming, it's completely natural to start hunting for alternatives. So today, we're bringing you a realist's guide to stem cell therapy for knees. We're going to cut through all the hype, rely strictly on the latest clinical data, and set a genuinely enthusiastic yet super realistic tone for what this regenerative option can actually do for you.
Okay, let's dive into this. We are going to systematically break down this whole procedure to answer your most pressing questions. Here's our roadmap. We'll start with the knee pain problem, then look at what are stem cells, walk through the 5-step procedure, figure out are you a candidate, compare therapy versus surgery, and finally, get to the bottom line.
Section 1. The knee pain problem. So, can stem cells save your knees? It's a huge question. You know, for nearly half of all people, osteoarthritis becomes a really debilitating reality at some point in their lives. It wrecks your mobility and constantly hangs that looming fear of a total knee replacement right over your head. Here's a crazy fact. Cartilage actually doesn't have its own blood supply. That's exactly why it notoriously struggles to heal on its own once it gets damaged. And honestly, that is exactly why over 600 clinics are now offering this stem cell treatment, and why patient interest is just skyrocketing. People are desperately searching for a real way to heal that tissue without having to go under the knife.
But hey, we need to be crystal clear right out of the gate here. This isn't some magical overnight cure. What it is, though, is a scientifically backed regenerative medicine alternative. It primarily uses your body's own cells to tackle cartilage damage and calm down inflammation. Essentially, they take highly concentrated healing cells and precisely place them directly into your damaged knee joint to actively support your body's natural repair process. And the best part? It does all of this completely without major surgery. The whole goal is getting you back to your weekend hikes, maybe a tennis match, or just playing with your grandkids without wincing in pain.
Section 2. What are stem cells? All right, let's transition into the science a bit and demystify exactly what we are putting into the knee joint. The cells most commonly used here are called mesenchymal stem cells, or MSCs for short. Think of MSCs like the master construction foreman of your body. When they get dropped into a damaged knee, they grab their hard hats and get right to work signaling and interacting with the surrounding area to promote healing in some seriously fascinating ways. They release growth factors to support cartilage repair, they actively shut down the inflammatory signals that are causing you all that pain and swelling, and they support the surrounding repair cells. They even have the potential to literally transform into actual cartilage-forming cells, which are called chondrocytes. Pretty amazing, right? And this brilliantly illustrates that not all stem cell injections are exactly the same. There are 3 main sources we're talking about here. First up is bone marrow aspirate concentrate, or BMAC, which is drawn straight from your own pelvis. Since it's your own body's material, the rejection risk is basically zero, and it's been widely studied. Second, we have adipocyte-derived stem cells, which are drawn from fat tissue, usually from the belly. These guys are highly concentrated, and recent data shows they might actually work a bit better for certain patients, though it definitely costs more. Finally, there's umbilical cord tissue, which is a donor source. The massive perk here, it packs really strong anti-inflammatory properties, and because it's already harvested from a donor, you don't have to go through a harvesting procedure yourself.
Section 3. The 5-step procedure.
So, let's shift focus to the actual day of the procedure. I know medical stuff can cause a lot of anxiety, so let's completely demystify this timeline together. Step 1 is your consultation and assessment, where the doc reviews your x-rays or MRI to map out the damage. Step 2 is cell harvesting. If you're using your own cells, they gather them from your bone marrow or fat right then and there. Step 3 is processing. They take that material and spin it in a centrifuge to really concentrate those crucial stem cells. Step 4 is the ultrasound-guided injection, which just means they use imaging to make absolutely sure those cells go exactly where they're needed most. And Step 5, same-day recovery. That's right, the whole shebang is minimally invasive and completely outpatient. The injection itself usually takes less than an hour, and you're sleeping in your own bed that night.
Section 4. Are you a candidate?
Okay, lean in for this one, because this is easily the most critical part of this entire explainer. Managing expectations is huge, which means knowing exactly who this therapy works for and, just as importantly, who it doesn't. Good candidates are usually active folks, maybe you're 55 and just want to stay on the tennis court, who have mild to moderate knee osteoarthritis. We're talking grades 2 to 3. Why? Because you still have lingering healthy tissue in there for those stem cells to actually interact with. Poor candidates are dealing with severe end-stage bone-on-bone arthritis, or maybe active infections or severe joint malalignment. So the crucial point is, if your cartilage is completely worn away and you're bone on bone, the regenerative process simply has no structural material left to work with. Stem cells are amazing, but they can't magically build a brand new knee from scratch. But let's ground the data for those of you who actually are good candidates. If you've got mild to moderate damage and you're appropriately selected by a specialist, the odds are actually remarkably in your favor. For reducing pain and getting your physical function back, the success rate sits at a very impressive 60 to 85%.
Section 5. Therapy versus surgery. All right, this is the ultimate medical crossroads right here, comparing regenerative therapy directly to traditional knee replacement. Stem cell therapy is a minimally invasive injection done under local anesthesia, and your recovery is measured in days to weeks. The results? They typically give you relief for about 1 to 3 years. A knee replacement, on the other hand, is major surgery. We're talking general or spinal anesthesia and months of absolutely grueling rehab. But to be fair, that artificial joint is going to last 10 to 15 plus years. Now, what's really interesting about this slide is how clearly it shows that stem cells are an incredible tool to delay surgery and keep you active if you have mild to moderate damage. But surgery still remains an absolute structural necessity for severe end-stage cases.
Section 6. The bottom line. Okay, we absolutely have to address the elephant in the room here, the cost. A realistic range for stem cell knee therapy falls somewhere between $7,000 and $10,000 per knee. Because this treatment isn't technically FDA approved as a standalone therapy yet, and most insurance companies, including Medicare, still consider it experimental, you're almost always paying for this entirely out of pocket. It is for sure a serious financial investment in your joint health.
And keep in mind, your return on that investment definitely is not instantaneous. Let's walk through what the recovery timeline actually looks like. Day 1, you're discharged and resting. By week 1, you are generally back to light daily activities. But here's the really important part. Meaningful improvement and actual pain reduction usually don't even start showing up until weeks 4 through 12. Unlike a quick cortisone shot that just temporarily masks your symptoms, stem cell therapy is a true, gradual biological repair process that unfolds over months. But the payoff is relief that can stick around for 1 to 3 years.
So I'm going to leave you with this proactive question to think about. Is it time to finally explore your options? You now know the science, you know what the ideal candidate looks like, and you know the true, realistic timeline of stem cell therapy. If you're managing chronic knee pain day in and day out, and you really want to try and preserve your joint, booking a consultation with a qualified orthopedic specialist is, without a doubt, your best next step to see if this regenerative path fits into your personal health journey. Keep learning, keep moving, and thank you so much for joining me for this explainer.